Happy Friday, Baylor College of Medicine and friends of Baylor. Well, I've been getting a lot of questions over the last several months, and I haven't done a Q&A. So this week we're going to do a Q&A. We're going to start with COVID, move to flu, and then we'll start dealing with any other crazy virus that's out there. So start with COVID questions. These are all from you, so listen up. My husband and I are in our 60s and in pretty good health. I'm trying to figure out which COVID vaccine is better than others. A few months ago, my allergist seemed to think the Novavax was the best. However, reading online, it seems like the other two might be better match for the strain going around. Which vaccine do you think is the best? Well, you're right. The best match right now is Moderna and Pfizer. Either it's okay. And Novavax actually is to last year's variant, so I'm not sure why they did that, but I think the mRNA vaccines are a better match. Unless you have problems with that vaccine, I'd go ahead and get them. I'm a 69-year-old female in Dallas with chronic asthma and allergies. I'm fully vaccinated, trying to determine which new vaccine is best for me. I've received only Pfizer up to now. I developed tinnitus, that's ringing of the ears, last September, and when vaccinated in January, it made my tinnitus much worse for several weeks. I wonder if there's no issue with mRNA shots, and should I try the Novavax shot instead, though it sounds like it's aimed at a different variant. You know, honestly, I didn't know this, so I went and looked at the database that has all of the reported complications, and it turns out tinnitus or ringing of the ears is a fairly common condition normally, forget the vaccine, just normally, about prevalence of about 14% of adults and 24% of older adults. And if you look from 20 to 23, the complication database received 18,000 reports of tinnitus or ringing of the ears after COVID vaccination. Median age was 51 to 59. Of course, that's the age where 25% of patients reported anyway. And according to the Vaccine Adverse Events Reporting System, which is that database, the incidence of tinnitus is about 84 per million vaccinations. Based on that information, it doesn't seem like it's any more prevalent after vaccines than it is normally, but it seems like it might be slightly increased. And so corticosteroids were used because it's thought to be an autoimmune. If there's autoimmune to some of the cells in the cochlear nerve, there might be a way to treat it with steroids. But so maybe yes, maybe it's a complication. It's not that big a well-known thing, and we don't really know if one of the vaccines would be worse or not. Okay, a question about recurrent COVID. I developed COVID this summer, took 5 days of Paxlovid and quickly became well. 2 days ago, I came down with the new symptoms and tested positive again. I have not been exposed to anyone known to have COVID this time, although in July 1, I was around my daughter who was ill and with it. Do you feel that this is a rebound COVID or a completely new infection? It is unlikely that since it was months and months ago that this is a rebound. It probably is a new infection, and there's so much virus around now, I'm sure you've been exposed to virus. But if anything that happened early summer, it would not be a rebound now. It's unusual to get it. If you had it in last summer, early in the summer, and to get it now is a little unusual, though. But I doubt it's a rebound. That's not I'm not convinced. It seems to be more likely that it's a new infection. You've mentioned packing Paxlovid if you're going on a trip out of the country. Is it possible to get a prescription without having a positive test? Yes, just ask your physician. How soon after testing positive for COVID should I start Paxlovid? The sooner the better. If I tested positive for COVID 2 days ago, is it too late for Paxlovid? Not too late, but if you're improving, there may not be any reason to do it. But it's not too late after 2 days. You still have a high viral burden. But if you're getting better, I probably wouldn't do it. The best time is to do it right away, as soon as you get symptoms. Is it possible to have flu and COVID at the same time? In theory, it's possible. Most of the time when people get a viral infection, you get all kinds of things that stimulate your immune system to prevent other viruses from coming. So it's not common to have two viruses at the same time unless you're immunocompromised. So, it's not that common. It's not common. I had COVID-like symptoms for 4 days but tested negative in at-home tests every day. In hindsight, should I have obtained a PCR test? There's so many other respiratory viruses circulating. I think if you had 2 negative tests, you probably didn't have COVID. Do you anticipate there will be a new COVID vaccine each year moving forward, similar to seasonal flu shots? I think we're seeing that, almost certainly. My husband and I are in our early 70s. The plan is to get the latest COVID vaccine when we get our flu shots next month. Is it okay to get both at once? Yes. I like this, go right through them. Try to get as many of the questions you asked out there as fast as I can. Oh, can you get free COVID tests? Well, it turns out you can now. There's a release for free COVID tests, up to 4 additional COVID tests at no charge. You just got to go to covidtest.gov. So that's in anticipation of the holidays. Okay, done with COVID. I got a bunch of RSV questions. So RSV, what is RSV? That's a hard one. It's called respiratory syncytial virus. It's a very common respiratory virus. It's really difficult to distinguish the symptoms from RSV from COVID. Usually spreads in the fall and winter. It turns out COVID has been mostly late summer and is now beginning to fall. RSV is no longer very prevalent around. When you look at our wastewater data, there's not much RSV. So there's no really easy test. If you really wanted to have a special test, you could get that from your physician. But so how common is RSV? It's between about 100,000 cases a year, 60 to 160,000 of older patients are hospitalized, and about 10,000 people die each year from RSV. There was a question, should I get vaccinated if I'm pregnant? Yes, RSV causes about 58 to 80,000 children under the age of 5 years old to be hospitalized each year. Infants 6 months and under are especially at risk for severe disease because they don't have any antibodies against it. If you get vaccinated in your 32nd to 36th week of pregnancy, you pass on those antibodies to your child when they're born, and so you get really a lot of protection at age 6 months, under 6 months. That was really the big advance with RSV. It's bad for old people, but it's really bad for newborns. And there are ways to treat RSV in young kids with antibody infusion, but RSV, getting vaccinated as you're pregnant is very, very good. What are the age recommendations for RSV vaccination? Well, CDC recommends that everyone age 75 and older get an RSV vaccine. Ages 60 to 74 who are at risk for severe disease, you have other problems, chronic heart disease, diabetes, nursing home residents, they're also recommended. I got mine. I just wanted to get one. It hurt. That one hurt. Should we add RSV shots at the same time as others? Sure. If you're eligible, yes. Okay, then I got a bunch of flu questions. Somebody asked, what do those letters mean? Well, I've been going over that a lot with you, but there are 4 types of influenza virus, A, B, C, and D. A and B are the ones that we talk about every year. C is rare and doesn't cause severe disease, and D is usually in cattle. A is the virus that causes, global pandemics and epidemics. That's what H5N1 is. And so B is the ones doesn't cause global pandemics. If you look at how it's divided, influenza A are divided into subtypes based on their 2 proteins on the viral surface. Maybe we have a picture of that, the red and blue there. It's the hemagglutinin and the neuraminidase. There are 18 different types of hemagglutinin, or H, and 11 different types of neuraminidase. So that's an H number and an N number. So H5 is the type of hemagglutinin. N1 is the type of neuraminidase. That's bird flu. What are the most common symptoms of flu? Fever, headache, and cough. If you search on those, that's what you usually get. How long after exposure does it take to get sick from flu? I don't know if you've ever had a flu before, but when I had every flu. I had the Asian flu. I had the swine flu. When you get it, you know it. You have an abrupt onset. You can almost remember the time. You get a severe fever, aches and pains, usually end up in bed. And people are most contagious during that first few days of infection. So here's an interesting question. Does flu spread like COVID? So actually, it's a little bit different. Flu is mostly in droplets, whereas COVID, remember, was aerosolized. So the thing about aerosols is that they float for a long time. Measles is like that. And so it's even more infectious. Droplets have only a short, can only land about 6 or 8 feet. But when we started with all the space reductions, 6 feet apart with COVID, that was because people thought it was like flu being transmitted by droplets. Turns out it was aerosolized. You wouldn't want, so when it's people singing with COVID, we're spreading it all over the place. With flu, it's just droplets, so it tends to be within 6 to 8 feet. So one person asked how many people do get flu in the United States. On average, it's about 8% of the population. I mentioned last week up to 50,000 people die each year, and almost up to 700,000 people in serious years can be infected. Okay. Now this is an interesting one. I was told this year's flu vaccine is local, not national. I'm not really sure what that meant. Is there any truth? I was told they were going to go visit Michigan and wanted to know if they would be exposed to a different flu. Well, it's a national flu. It's all over. It's a worldwide flu. There are times when different variants show up. So remember, it was H3N1 kind of showed up late in the flu season, but it's all over the country. So no matter where you go, if you've got your flu shot, it's going to protect you wherever you go, even if you go to Michigan. Okay, is there an association with seasonal flu shots and adverse outcomes with pregnancies? So there was an 82,000 study in JAMA looking at this issue, and there was no associated increased risk of perinatal outcomes. So there doesn't seem to be. Somebody asked, are there other treatments for flu? Well, vaccination is the best, but there are 4 different types of antivirals. Most of them are targeted to the neuraminidase, one of the proteins on the cell surface. Okay, then we're moving on to avian flu. What have we done? Let's see. We've done COVID, we were doing flu, now we're on to avian flu. Should I worry about an avian flu pandemic? I'm worried about it. You should probably worry about it. The CDC and the FDA are following it. I mentioned last week, I actually think we should be developing the vaccines right now, and I think we should be vaccinating cattle, probably pigs too, and maybe be ready to vaccinate people, but I'm worried about it. What would be a reason to test for avian flu? Well, if you're symptomatic, one thing, if you've been hanging around unpasteurized milk in herds that are known to be H5N1 positive, or if you like to hang around wild birds that are dead on your lawn. So I wouldn't do that. But those are the reasons why you might get exposed. You talked about avian flu being detected in wastewater. If the testing shows the presence of the virus in wastewater, is it possible there are many more cases than have been reported? Yeah, I mean, that's the concern. The concern is that we've only tested the people who are symptomatic, who have been in the field. There's a lot of H5N1 in wastewater. Probably a lot of it's from animals, from wild birds or cattle or infected poultry, but you don't know. So the big concern is, are we testing enough? This is a good one. Can bird flu be transmitted through uncooked chicken that you purchase at the grocery store? I don't think it can be. It's interesting. I mean, geez, I don't. The chickens that you get in the grocery store have gone through plucking and washing and all kinds of things. I think they're probably pretty darn clean. I doubt it. Unpasteurized milk, yes. Or if you're hanging around millions or thousands of poultry that are infected laying eggs and you happen to be it and going in to collect those eggs, yeah. Okay, we're almost done. Update on West Nile. What's happening in West Nile? Well, it's still going. It's still very prevalent. 377 cases identified so far, 255 neuroinvasive disease, so it's a pretty good West Nile season. I just pulled up the counties that are positive. Mostly you can see in the south. Texas is a big hot point. These are the number of cases per state, 46 in Texas. We're number 1. We like to be number 1 in Texas. 46 in Texas, 26 and 25 in California, and New York. For some reason, Nebraska has got 30. Who knows what's going on in Nebraska? Can you give an update on or outbreak? No. Nothing's really changed. It's still mostly all in people who've traveled from Cuba to the United States. All right, that's enough. Y'all are wearing me out. All right, so we're done this week on our Q&A. We'll have another Q&A in another few months, but I want to end today with a bunch of shout-outs. First of all, we are celebrating Hispanic Heritage Month from September 15th to October 15th in celebration of the histories, cultures, and contributions of American citizens whose ancestors came from Spain, Mexico, the Caribbean, Central and South America. In Houston, Mayor Whitmire recognized the individual with the Mayor's Hispanic Heritage Awards, honoring exemplary Hispanics who made the outstanding contributions toward improving the quality of the Houston Hispanic community. And I want to congratulate Dr. Andrea Cruz, who received the 2024 Mayor's Hispanic Heritage Award in Healthcare for her work to improve care of children with TB through educational programs in the Hispanic community in Houston. She's a professor of pediatrics at Baylor and director of the TB clinic at Texas Children's. Also, congratulations to Ruben Hernandez, who received the Common Spirit Health Physician Enterprise Academic Excellence Award that recognized the importance of advancing the practice of medicine through research. Associate Professor of Medicine at Baylor, specializing in GI, and was selected for his published research on transplant patients with chronic liver disease. And finally, I want to brag on Baylor College of Medicine. This week I was in the country of Botswana, where Baylor College of Medicine was recognized with the prestigious Presidential Order of Honor from President Magwitsi Masisi. And the award is presented to individuals or organizations who contributed to the development of the nation and well-being of its people. It occurs annually on the Republic of Botswana Independence Day celebration. Baylor has supported the people of Botswana for more than 20 years when we began the first treatment for pediatric AIDS on the continent of Africa. Botswana has become the first high-burden country to be certified with the WHO for reducing mother-to-child transmission of HIV to less than 2%. We are deeply honored as a community, as a school, and we recognize our ongoing work with the people of Botswana. And a special shout out to President Masisi for recognizing all that we do at the Baylor College of Medicine for his country. And with that, can't wait to see you next week.